Welcome to the Stakeholder Education Plan presentation by Mini Chakyat Varghese at Brandman University. In this presentation, I will be talking about the definition of stakeholder groups and roles, education theory and conceptual framework, education intervention, and the implementation plan. Before we move on, I would like to discuss with you the P chord. The P, or the patient population, is pre-end stage renal disease, stage 3 to 5 patients who are under the care of a nephrologist and who might need dialysis in the near future. The I, or the intervention, is pre-ESRD education and follow-up. C, or the comparison group, is patients who receive education and follow-up and who do not receive education and follow-up. O, or the outcome, is prevention of emergent start of renal replacement therapy. T, which is the time frame, is 6 months. The stakeholder groups are the nephrologist, the Medicare, the insurance payers, the hospitals, individuals who have invested in the business, administrators, nurses and patient care technicians, social workers and dietitians, patients and families. Stakeholders have different roles. For example, the nephrologists need to refer patients for the pre-ESRD education. They need to prepare the patients for dialysis treatment in order to prevent emergent dialysis. This will in turn reduce the cost of hospital admissions. The nurses, the patient care technicians, the social workers, and dietitians need to provide quality care to the patients. Patients need to attend the educational classes, and also they need to stick to the plan to prolong the life expectancy. All these plans will help in improving the health-related quality of life of dialysis patients. Theory of change is the educational theory that I chose for my education plan. It is essentially a comprehensive description and illustration of how and why a desired change is expected to happen in a particular context. In my scholarly project, the nephrologist need to write an order for the patients to attend the pre-ESRD classes. The patients need to take the decision of attending those classes. The multidisciplinary team or the educators need to train these patients effectively in order to see the expected outcome. The conceptual framework to educational interventions are identifying opportunity areas, creating a good education plan, using the best teaching strategies, choose a conducive environment to learn, communicate effectively as and when needed, reassess the needs and create an action plan for improving the teaching methods, and again evaluate the outcome. In order for my scholarly project to be successful, I know that I have to get the buy-in from the stakeholders. The educational intervention plans for the stakeholders are as following. Discuss policy on pre-end stage renal disease education. Explain about the need for consents and orders. Talk to them about their fears and barriers. Explain the financial, the clinical, the social, and emotional advantages of the project. Discuss methods and project implementation strategies. Answer any questions that they might have. Implement education plan to individuals and small community settings. Last but not the least, organize awareness days. I have a great implementation plan in order for my project to be very successful. And the first and foremost is, again, to get the buy-in from the stakeholders. I would first invite all the stakeholders to participate in a meeting. Then I will organize a lunch meeting with them. First and foremost, I will be talking to them about the project and showing them how cost effective is my idea or the project. Provide with them step-by-step guide to refer patients for pre-ESRD classes. I will have them listen to the Kidney Smart education video. I am sure that once they listen to this, they will have much more idea or understanding about this project. Encourage stakeholders to participate in kidney walk and other awareness days. Discuss with them about health-related quality of life of our patients. Explain again the financial, clinical, and mental, emotional outcomes of this particular education. Answer all their questions and be available to discuss further. Set up regular monthly meetings or monthly calls in order to discuss the progress of the project and also to discuss the success of the program. Receive and also provide guidance. These are the implementation plans which makes me think that this is going to be a great success and also that our patients will live longer as a chronic dialysis or chronic kidney failure patients. Please see the references that I used for this PowerPoint presentation, and thank you for listening.